Hi, everyone. Thanks for joining us. I am Aimee Drescher, clinical psychologist.
And hey, I'm Dr. Carson Felkel, a child, adolescent, adult psychiatrist.
So last time we talked about our focus for this session would be around our high-risk teenagers. And given that September is Suicide Awareness Month, it fits very nicely into the conversation we're going to have today around our teenagers who have some suicidal ideation or self-harming behaviors. So Carson, you are a child and adolescent psychiatrist, and I would imagine that often you are seeing some of our higher risk teenagers. What are you seeing in your practice, and what advice or guidance can you offer to our audience around how to handle these situations?
Sure. I mean, frequently teenagers are referred for suicidal ideation. And to me, when I hear that, it's not very specific. It's a big spectrum of what people could present with. And so, I mean, just in this short time, I want to empower parents and teachers to sit with these big emotions that their kids are telling them and try not to be too reactive. So when a kid says they're suicidal, I try to unpack that a little bit. And the majority of the time, kids want to escape or disappear. Life is so tough, and they don't feel like they have the tools to deal with it. And so it makes sense to me that the brain automatically thinks, what if you died in your sleep and didn't wake up? Then you wouldn't have to face all this stuff. And so that's kind of on the lower risk end. The next step would be that someone actually has some thoughts about killing themselves. The next level up would be someone's thought about a plan. And then even higher risk would be an intent to act on that plan. Now, there's also kids that have behaviors and they've done something to hurt themselves. And that's also really important to unpack, because a lot of kids might pinch themselves, scratch themselves, even cut themselves to make their negative affect, their bad feelings go away, or they feel numb and they want to feel something. But on the other hand, there's also kids that cut with the intent of dying or killing themselves. And again, that is high risk. So that's why it's so important. If a kid is feeling really badly, it's just important to listen to how they're actually feeling. The Columbia Suicide Severity Rating Scale unpacks all of this and is validated for parents to do, for teachers to do. So that's a great tool to turn to. Google Lighthouse Project. You'll find all these resources. Aimee, what are you talking about with parents when there's these big emotions in teens?
I think the biggest message that I try to help, parents and teachers with is to not panic, to remain calm and be able to sit and create a safe space for your kiddo to talk about what is happening with them. I know as a parent and a parent of teenagers that it can be really hard to hear what our kids are thinking and feeling, especially now with what we're dealing with in the world. It has been very difficult to determine, even when I'm seeing kids in practice, it's difficult to determine how much of this is really about what's happening in the world right now versus something that would have happened outside of COVID and the isolation and not going to school and all the things that our kids are experiencing. So I try to remind myself and remind, the folks that I work with that right now, when your kids are having this, these thoughts and these feelings, something is sending them a message, and now they're sending the message to you. So really helping them, being calm, sitting with them, unpacking what's happening with them can be really helpful, because you might just find that they are not, so far down the spectrum of the self-injurious behavior and the thoughts that they're having, and that just by talking about it, we can reassure them that things are going to be okay. So I do think it's hard. It's hard to sit and hear kiddos having, those feelings. And at the same time, the best intervention is to be able to sit with it and help them as an adult and stay calm.
Yeah, what my approach is to take any power away from these thoughts and emotions that they're having. That doesn't mean to debunk them or to minimize them, but I just don't want the thought itself to have any power. And a lot of times kids will have this thinking that comes through their mind that says, I should die. That's my form of escape. And then they feel guilty, and then they don't want to talk to their parent. And then they feel, why am I having all these worries? And then they get worse. And so the metaphor I use with parents, it comes back to acceptance and commitment therapy, but it's really, how do we diffuse our emotions and our thinking? And so there's this idea of a school bus, and we're each the own driver of the school bus, and we're heading towards some point in our life, what we value. And there's kids getting on the bus, and these kids are our thoughts. They could be good, quiet kids that sit down right away, or they could be bullies on the bus that are rowdy and maybe swinging at another kid. It doesn't matter whether they're a good or bad kid. To the degree that we turn around and we tell them to be quiet, to sit down, we're taking our eyes off the road. And so my hope is that whether it's a suicidal thought, whether it's a good thought of, I got to be the best student, either way, we want to not be too focused on those kids, those thoughts.
Absolutely. I really like that analogy, and I will absolutely use it. That's really great. So we've been getting some really great questions coming, and the last, few sessions have been really focused on helping our parents, and teenagers and our teachers. So this next couple of sessions that we're going to do will definitely focus on some of those great questions that you guys have provided to us. So thank you all for joining.
Yes, stay tuned for more. We'll look forward to talking to you soon. Bye.